Today I will demonstrate auscultation of heart sound. And before auscultation of heart sound, I have to take the consent of the subject. Give me the consent. Patient has given me the consent. Now I am standing on the right hand side with proper illumination and proper exposure of the area to be examined. And so standing on the right hand side of the subject, I'm standing on the right hand side, proper illumination, proper area is exposed. Which area I have to examine? I have to examine the precordium. What is precordium? It is the part of the anterior chest wall which overlies the heart. Now there are four auscultatory areas. What are the four auscultatory areas? Mitral area, tricuspid area, pulmonary area and aortic area. Now mitral area corresponds with the apex beat. So first, to find out the mitral area, we have to first find out the apex beat first. Without finding out the apex beat, if you count the number of ribs and find the apex beat, then it will be totally wrong. Because if there is shifting of the apex beat to the lateral side, there is shifting of the mitral area also. So first, you have to palpate the apex beat, then you find out the mitral area. Now, tricuspid area is on the left fifth intercostal space, close to the left border of the sternum. Pulmonary area is on the left second intercostal space, close to the left border of the sternum. Aortic area is the right second intercostal space, close to the right border of the sternum. These four auscultatory areas I have to auscultate with the help of the stethoscope. Now, there are four heart sound. First heart sound, second heart sound, third and fourth heart sound. Normally, with the help of the stethoscope, we will be able to auscultate first and second heart sound only. Third and heart sound may be audible in abnormal situations, but usually third and fourth heart sound is audible with the help of phonocardiogram. Now I am demonstrating the finding out the palpation of apex beat first, because you have to start from the mitral sequentially. You have to start from the mitral area, then tricuspid area, then pulmonary area, then aortic area, auscultation. So I am palpating the apex beat with the root of our fingers. Place the palm downwards and laterally over the precordium and try to find out the under which finger the definite thrust is felt. According to the definition of apex beat, it is the downmost and outermost part of the precordium where a definite thrust is felt. Now I am feeling the definite thrust over the below my ring finger. So now I am counting the space. This is suprasternal notch. Now from here I am climbing here. This is manubrium sternum, the most prominent part of the sternum. Now I am going there. It is articulating with the second rib. So this is second costal cartilage. This is second rib. This is third rib, third space. Fourth rib, fourth space. Now fifth rib, fifth space. So I have palpated the apex beat and it is found in the left fifth intercostal space, just medial to the midclavicular line. Midclavicular line is an imaginary line between the tip of the acromion and the sternal head of the. While holding the stethoscope, it is discovered by Lennox. The earpiece should be directed downwards, forwards, and medially, according to the direction of the external auditory meters. And chest piece should be placed over the apex beat. Now, first do this like this. Then you will get the sound. Now place the chest piece over the where the apex beat is palpable. Now ask the subject to rotate his mouth on the left side and place the left thumb over the right carotid artery. Now I am auscultating sounds. Tuk, 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 tuk. I don't know which one is first and which one is second. The sound which is corresponding with the carotid pulse, that is the first heart sound, and that is which one is following the sound, that is the second heart sound. So in the mitral area, both first and second heart sound is audible. Now I am again, to find out all the areas, you have to count the space. Now I am counting the tricuspid, finding out the tricuspid. This is suprasternal notch, manubrium sternum. This is second rib, second space, third rib, third space, fourth rib, fourth space, fifth rib, fifth space. So tricuspid area is on the left fifth intercostal space, close to the left border of the sternum. Again, I am giving my thumb over the right carotid artery. Now I am auscultating both. Tuk, 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 tuk. I don't know which one is first, which one is second. So the sound which is corresponding with the first heart sound, with the carotid pulse, that is the first heart sound. The sound which is following the First heart sound that is not corresponding with the carotid pulse is the second heart sound. This is the auscultation of the tricuspid area. Now pulmonary area. Pulmonary area, I have to find out again by counting the space. Suprasternal notch, manubrium sterni, second rib, second intercostal space. Pulmonary area is on the left second intercostal space close to the left border of the sternum. Again, I am listening some duk duk sounds. Now, which one is that is the lab duk sound. Now, I don't know which one is first and which one is second. Now, again, placing the thumb over the right carotid artery. Now, the sound which is corresponding, this is the first heart sound, and the sound which is not corresponding, this is the second heart sound. This is the auscultation of the pulmonary area. Now, aortic area, in the right second intercostal space, right second, this is manubrium sterni, suprasternal notch, manubrium sterni, second rib, right second intercostal space, close to the right border of the sternum. Again, left thumb should be placed over the right carotid artery. Now again I am auscultating some sounds. Lap tuk or tuk 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 tuk. The sound which is coinciding with the carotid pulse, that is the first heart sound, which is not coinciding, that is the second heart sound. This is my auscultatory findings. Now what I have to mention after auscultation of the four areas, what we have to mention, both first and second heart sound is audible in the mitral area, tricuspid area, pulmonary area and aortic area. This is most important. That means in all the four areas, both first and second heart sound is audible. This is the first point you have to mention. Second point is, as I have ausculted the four areas, now I can compare on which area which sound is most prominent. So as I have ausculted the four areas, so first heart sound is based out on the mitral area I have got, and second heart sound is based out in the pulmonary component in the pulmonary area and aortic component in the aortic area. First heart sound has also two component, tricuspid component, mitral component, but I can't separate it. This is the first point. That is the in all the four areas, it's mitral area, tricuspid area, pulmonary area, aortic area. Both first and second heart sound is audible. This is the most important thing. And second thing is important. You have to palpate the apex beat first, then find out the mitral area, then auscultate the apex mitral area, and thumb in all the four areas while auscultating, left thumb should be always on the right carotid artery. Now, again, what I have to mention after what is your findings? My findings is both first and second heart sound is audible in mitral area, tricuspid area, pulmonary area, and aortic area. Second point, the first heart sound is based out in the mitral area, and second heart sound pulmonary component is based out in the pulmonary area, and aortic component of the second heart sound is based out in the aortic area. Third point, as I have auscultated over all the auscultated areas, there is no adventitious sound that is murmur or pericardial rub. And fourth point you have to mention, there is physiological splitting of the second heart sound is audible during deep inspiration in the pulmonary area. Now, what is physiological splitting of the second heart sound? I think all of you know. I am not going to that. The examiner will then ask you at least one condition when you will get the pathological splitting of the second heart sound. That is the atrial septal defect and ventricular septal defect also. But wide and fixed splitting you will get in atrial septal defect. This you have to mention. So points to remember that you have to first palpate the apex beat. Number one. This corresponds with the mitral area. Second point, your thumb should be always on the right carotid artery, left thumb on right carotid artery. And third point is most important point. In all the four areas, both first and second heart sound is audible. You have to mention. And then other points I have already mentioned. You have to mention that also. Thank you.